Parents tell us something almost every single week in our office. We've been to every specialist, we've run every test, but nobody can tell us why our child is struggling. The blood work comes back normal. The MRI shows nothing. The EEG is clear, and yet your child is still dealing with chronic ear infections, speech delays, sensory meltdowns, focus challenges, or sleep struggles that just won't quit. Here's what's actually happening. Traditional pediatric medicine is trained to look for pathology and disease. They're asking the question, is something seriously wrong? But they're completely missing the most important question. How well is the nervous system actually functioning? Your pediatrician tracks your child's height and weight at every visit, which is important. But what about the system that controls digestion, immunity, sleep, movement, behavior, emotions, and development? What about the system acting like the air traffic controller of your child's entire body? That's where insight scans come in. And for thousands of families, these scans have finally provided the answers they'd been looking for. This video is for parents who are exhausted from collecting diagnoses without getting real solutions. Parents who've been told they'll grow out of it, or let's just wait and see. When deep down you know something needs to change. This is for families who are ready to understand what's actually happening underneath all those signs and symptoms. In this video, you're going to discover why traditional pediatric exams often miss the most critical piece of your child's health puzzle. You'll learn about the 3 different scans that measure nervous system function, what patterns like raging bull and drunken bull actually mean for your child, and why having objective data changes everything when it comes to getting real answers and real progress. Let me tell you about Braxton. At just 1 week old, Braxton's parents were told their beautiful baby boy needed to be evaluated for seizures and infantile spasms. Every time they laid him on his back, he would go into these uncomfortable spasms. They couldn't sleep. They were terrified to even change his diaper. Multiple neurological specialists told them that the spasms would likely get worse, and the next step would be a hospital EEG. But while they were waiting 4 weeks for that appointment, their doctor recommended something different: neurological insight scans. Braxton's scans showed that his nervous system was extremely stressed and dysregulated. Birth stress had essentially locked his body into fight or flight mode, making it impossible for his system to calm and coordinate properly. But here's what made all the difference. The scans didn't just give them another diagnosis, they revealed the root cause and helped guide a safe plan to actually help his nervous system de-stress and heal. After just the first week of gentle, specific chiropractic adjustments, Braxton stopped having spasms. Not a single one. His mom described him as calm, happy, and finally sleeping beautifully. And when they finally made it to that hospital EEG appointment weeks later, the results came back completely clear of seizure activity. Today, Braxton is thriving because his parents discovered the test that actually measured what mattered. To understand why this happens, we have to talk about what traditional medicine often misses. Most pediatric testing focuses on identifying obvious disease or structural damage. Doctors run blood work looking for abnormal markers. They order MRIs to find structural problems in the brain or spine. EEGs are used to check for seizure activity. All these tests are asking essentially the same question: is there something seriously damaged or diseased? But here's the challenge. Nearly 1 in 12 children in the United States has a speech or language condition. The vast majority of these children have completely normal blood work, normal MRIs, and normal EEGs. Traditional testing often says everything looks fine, even though parents can clearly see their child is struggling. What those tests miss is the most important piece: nervous system function. While your pediatrician tracks height and weight to measure growth, insight scans measure whether the system responsible for growth, digestion, immunity, sleep, behavior, and coordination is actually functioning properly. The nervous system truly is the air traffic controller of the child's body. When it's stuck in a constant stress response due to prenatal tension, birth trauma, or early childhood challenges, every other system in the body can begin to struggle as well. This is where insight technology becomes incredibly valuable. These scans give us 3 different measurements that work together to show exactly what's happening in your child's nervous system. The first is the neurothermal scan. This scan measures temperature differences along the spine that reflect how stress is affecting the organs and autonomic nervous system. It often helps explain challenges like reflux, constipation, chronic ear infections, and frequent illnesses. The second is the neurospinal EMG scan. This scan measures muscle tension and neurological stress patterns in the spine and surrounding nervous system. It helps us understand issues like developmental delays, sensory struggles, coordination challenges, and focus problems. The third is the HRV scan, which stands for heart rate variability. This scan shows us how well your child's nervous system adapts to stress and whether their body can shift appropriately between fight or flight and rest and digest states. When HRV is low, it often explains why children struggle with transitions, emotional regulation, sleep, and chronic overstimulation. Together, these three scans give us a complete picture that traditional medicine never even looks for. One of the most fascinating things we see on these scans are specific stress patterns that explain why a child is struggling the way they are. A pattern we call the raging bull shows a nervous system stuck in overdrive. These kids often experience anxiety, hyperactivity, behavior challenges, and poor sleep because their systems simply can't shut off. Another pattern we call the drunken bull reflects poor organization and coordination in the nervous system. These children may struggle with focus, low muscle tone, sensory processing issues, or learning challenges. Sometimes we even see a combination of both patterns at the same time. These patterns often come from what we call the perfect storm, a combination of prenatal stress, birth trauma, early illness, antibiotic exposure, and environmental pressures that build up over time and lock the nervous system into dysfunction. For example, research shows that children who receive more than 6 rounds of antibiotics before age 3 have significantly higher risks of allergies, asthma, and digestive issues later in life. These early stressors compound and place increasing pressure on a developing nervous system. But here's the encouraging part. Kids are not stuck this way. When nervous system balance is restored, the scan patterns change, and so does their health and development. This is why insight scans change everything. Instead of guessing, we now have objective data showing exactly what's happening in your child's nervous system and exactly how it's changing over time. Therapy alone can sometimes feel like pushing a car with the parking brake on. Parents are doing everything right: speech therapy, occupational therapy, behavioral work, but progress feels slow or inconsistent because the neurological foundation isn't fully working. When insight scans reveal patterns of dysautonomia or nervous system stress, it helps explain why those therapies might be stalling. And once the nervous system begins fully functioning properly again, many parents see other therapies start working much more effectively. Sleep improves, digestion improves, behavior becomes more regulated, focus gets better, immunity strengthens, and we can actually measure that progress through follow-up scans. So if you're tired of hearing wait and see or collecting labels without getting real answers, insight scans might be exactly what your family needs. These scans reveal what traditional medicine often overlooks and give families a clear path forward instead of more guesswork. Your child deserves more than symptom management. They deserve a nervous system that's functioning at its full potential so they can truly thrive. If you'd like to learn more, click the link in our bio, send us a message, or schedule directly with us at Foundations Chiropractic. Let's get your child the answers and the help they deserve.